This incident at a New Hampshire hospital has many wondering what their rights are when it comes to receiving medical care. Still to come this morning, we've got a legal expert here to answer that very question. It's a local story that's made national headlines. Hospital lab tech is accused of contaminating syringes from a hospital in Exeter, New Hampshire. 30 people have now been diagnosed with the same strain of hepatitis C that he carries, and thousands of people now need to be tested. So this had us asking and thinking as patients, what are our rights and what do we need to know before getting a medical procedure or even a simple blood test? Joining me now this morning is attorney Ben Zimmermann, principal with Sugarman. And Sugarman, thanks for being with us this morning.
Thanks for having me.
You know, we were just saying some of these people went to the hospital just to have a simple blood test. They weren't even getting a serious procedure. So if you're going to a hospital like this, is there any way you can protect yourself legally speaking from something like this?
Yeah, I think the unfortunate and sort of unsettling thing is not much. We all pick our healthcare providers in our hospitals with faith that they're going to give us the proper care and by properly trained staff. And sometimes it just doesn't happen, and it's sad and sort of scary.
Yeah, I mean, is this so a false sense of security that we have going into a hospital thinking this is a safe zone?
Well, I think the good news is that most hospital employees do their job, and generally the care is good. But sometimes things like this happen, and again, there's not much the actual patient can do to control that. That has to be in the hands of managers and people overseeing the employees.
So if you were to fall into this category of some of these people that have contracted hepatitis C, they have no recourse?
Well, they have recourse in the courts, certainly. Unfortunately, they'd rather not have the recourse. They'd rather have not gotten the disease in the first place.
Right.
So they have potential claims they can bring, but going in, I don't think there's anything any of them could have done to prevent what happened to them.
I mean, a lot of people, you go into the hospital, you sign about 1 million pieces of paper. What is it exactly that you're signing then? Are you giving up any rights you have, basically, if something happens to you there?
Yeah, a lot of times people remember signing some form before they were wheeled off to the OR. And those forms are generally consent forms. So, for example, with a surgery, they'll say, well, you have a risk of bleeding, infection, and maybe a remote risk of death. And the patient accepts those risks because they need the procedure. But generally what those forms are not consenting to is inadequate or improper care. So you're not signing off your rights necessarily when you're going into the procedure.
So these people, I know that they're part of a class action lawsuit now that's being launched. And is that sort of the only angle that you can take with this? Because I know they're part of basically like a patient's rights group now that are going to sue, but it's not the hospital they're suing, is it? It's the group that hired this young man in the first place.
Well, I think there are a lot of unanswered questions. Obviously, this story is unfolding every day, but clearly those people, in terms of bringing claims, are going to look at the company that this gentleman worked for and the hospital potentially, and I know those claims are ongoing.
Well, and one of the things that was interesting to me that I didn't realize ahead of this, and we were talking about this a little off camera, is that right now the licensing is not federal, it's state to state, that there's different laws for each state. And this young man was a traveling nurse, so to speak, so they don't have the same rules here in Massachusetts as they would in New Hampshire and elsewhere. Is that something that you think might need to be overhauled?
Well, it sounds like there's some really good rights groups who are getting involved in that, and they are trying to get what we would kind of all expect, which is the people are being tested and screened before they're given needles and medications. And I think we can all hope, and if our expectations weren't met before, that they'll be met in the future with some better regulation.
It's a little bit scary. I know that I know that Senator Kelly Ayotte and one of the women from this patients' rights group are thinking about, looking into this type of legislation to change that, because how scary. I mean, you walk into a hospital, I think it's one of the places that you consider yourself safe in. So if you're going to walk into a hospital like this, what would you recommend folks do?
I think that all they can do is do their due diligence, go to a hospital and a provider that they trust, and they really do put themselves in the hands of these providers to make sure that the people working for them are trained and are giving the care that the patients deserve.
All right. Attorney Ben Zimmermann, we appreciate your perspective on this.
Thank you very much for having me.
Thank you. All right, we'll toss it over to Elizabeth now.